Hi, welcome to the clinic. Are you here for your biopsy? Okay, very good. You can just have a seat here. I'm gonna get my stuff ready and we can begin, okay? So what made you decide to come in today? Or better yet, when did you notice this lesion or spot that you are concerned about? About a month ago? Okay. Well, it's good that you've come in. It might not be anything to be concerned about, but the earlier you come in for these kinds of things, the better. It's good to be proactive. So I'm Dr. Starr, by the way. I'm going to start by just taking your vitals, okay? I'm going to check your heartbeat. Uh-oh. Oh, there we go. Okay. Okay, I'm just going to put this on your chest. I want you to breathe normally at first. Okay. Okay, sounds good. I'm just gonna have you take some deep breaths now. So I'm gonna have you breathe in and out. Again. One more time. I'm just gonna do it on your back one more time, okay? Okay. Very good. I hear no irregularities. I'm going to check your temperature really quick. I'm just gonna put this up to your forehead, okay? Beep, beep. Okay. You're at 97.8, which is perfect. So everything looks good on that front. We can begin now. I'm gonna have you, and you said it's on your head, right? Okay. I'm gonna have you find that for me and part out your hair. And I'm just gonna take some tools just to look through your hair without really disrupting anything, and so I can get a closer look, okay? So I'm just gonna go up here. I'm just gonna take these two sticks and I'm just going to okay, I see it right here. I'm gonna touch it with my fingers, okay? I'm just gonna palpate it a little bit. Figure out if it's hard or soft or... Okay. Now it's slightly red, which means it might be a little irritated. But whatever it is, we're gonna get it off and we're gonna figure out exactly what it is and if it's dangerous or not, okay? So I'm just gonna take my flashlight, which also has this pupil gauge, but I'm going to actually use it to gauge the size. So let me see. I'm just going to check it with my flashlight. Okay. Now it is an 8 in diameter right here, which is not big, but it's also not small. Let me just write that down. So what we're gonna do now, and has this been causing you any pain? Just when you scratch it? Okay. Yeah, I would definitely recommend in the future if this happens again. I know it can be difficult because it's itchy or irritated, but just try not to touch it as much as possible, okay? Yeah. Just looking for my lancets. Okay. Now for this procedure, I'm going to try to be as minimally invasive as possible. So I'm going to start by using a lancet, which is a tiny needle that's inside here. You can see it, it's incredibly tiny. I'm gonna see if I can get it off with this, and if not, then we will use a scalpel. I will be giving you some localized anesthesia, okay? So you will be awake, but you will not feel it, okay? Okay, let me get that. Sorry, I just moved offices, so I'm a little all over the place. Okay, where is it? Oh, here we go. Okay. So I'm just gonna start now with the anesthesia, okay? It's gonna just feel like a little pinprick, and that's it. And then I'm going to move it through the skin to make sure that it's administered equally, okay? Okay. Ready? Good. And going in, you'll feel a little prick. And slowly pushing that anesthesia through. Okay, it's all done. How did that feel? Okay, very good. Now I'm just going to palpate and rub this through. Very good. Now I'm going to use some glasses for this, just to make sure that if anything is inside, that it doesn't get in my eyes. And then I will also be putting on a mask, just in case. We're gonna try with the lancet, okay? Now, let me just test first if you can feel. I'm gonna use these little tweezers, and I'm just gonna poke you, and I want you to tell me if you feel it, okay? Did you feel that? No, okay. What about that? You seem to be all numbed up, which is great. And we're gonna go in with our first lancet. Just going to pop this open and let's begin, okay? Taking this and just putting it right under, and we're just working my way just to really lift it off of the skin. There's some minimal bleeding, but that's okay. I'm gonna take this alcohol wipe. Get the blood. So far, so good, okay? Okay, let's continue. The lancet seems to be working, which is great. Okay. Come over the side. Very good. And seems to be completely lifted. We're gonna take these tweezers, okay? I'm just going to remove it. First, let me make sure I have my okay, this is what we're gonna put our sample in. So let's go in and gently take it off. I'm gonna lift it. I'm gonna grab it and lift. Okay, got it. Okay, here is our sample. We're gonna take these to our labs, and if you have an online account with the labs, you can check the progress, status updates, everything like that, or you can just give me a call, and we will certainly give you a call as well when we get the results ourselves, okay? Okay, I'm going to just clean you up one more time. No need for stitches or anything. There's very, very minimal bleeding, so I'm just going to clean you up. And I would put a band-aid on, but since it's in your hair, it's just gonna stick to your hair. Okay, there you go. You are all set. Everything looks good. There was very, very minimal bleeding, and when I uncovered and lifted it off, it was just your normal skin under there. It wasn't anything hiding beneath the surface. So in my humble opinion, I don't think it's anything to be concerned about. But I still think it's great that you came in and got it checked out, and let's hope for when we get those results back that there's nothing to worry about, okay? Thank you so much for coming in, and if for any reason you start to feel pain in the next couple hours, you could take a Tylenol or an Advil, and that should do the trick just fine, okay? Okay. Well, have a great rest of your day, okay?